credentials?
I have a master's degree in nursing, and I'm also a certified medical surgical RN.
What is your specialty?
My current specialty, I'm in nursing leadership. My official title is nursing director.
How long have you been in healthcare?
I have been in healthcare almost 9 years.
What jobs did you have before nursing?
So before I was a nurse, I was a salon assistant when I was 15. And then when I went to college, I became a desk assistant. So I helped manage the front desk when people got locked out and stuff like that. And then I became the desk manager of that desk my senior year. And then after that, I was a nurse.
Which jobs or skills help you the most in your nursing career?
All of them. I mean, all of them involve people and customer service, and specifically my desk manager job taught me a lot about organization. So all of them have helped me what I do today.
What or who motivated you to go into nursing?
I don't think no one really motivated me. I was just really good at math and science. Um, I wanted to be a teacher, but that didn't pay enough for me. So I said, well, what can I do with math and science? And I came up with nursing. We had a nursing, like an LPN program in my high school. So I actually was selected out of all the people that applied. There were only two of us that got that particular class, and I was one of them. So I would go to a vocational school every day. I was pretty much done with my high school credits. So they let me go to a vocational school and take LPN classes, and that's what I did. And that's kind of how I got into it.
Did you consider any other role in healthcare?
No, not really. I mean, physical therapy seemed cool, but that's no. I always wanted to be a nurse.
How do you respond to the question, why didn't you become a doctor?
I didn't want to be in school that long. I had no interest in going to school and then having to go back for 8 years. And then if I wanted to like specialize, going back again for oh no, I wanted to have my 4 years in school, get my degree, pass my get my RN license, and be done.
What do you wish you knew or did before nursing school?
Um, I wish I knew what was all out there. When you think of nurse, you think of bedside nursing. You watch Grey's Anatomy and all those other TV shows, and you have a perception of what nursing is. But no true mentorship, I guess, in nursing. So that would have been nice to have in the beginning.
Where did you go to school?
I went to George Mason University for my bachelor's degree. And then for my master's degree, I went to the University of Maryland, Baltimore.
How did you pick your schools?
So I wanted to be local, in-state tuition. And then for my master's degree, I just picked a school that had a program that kind of aligned with my goal at the time.
Did you shadow anyone before pursuing nursing or your specialty?
Nope. Just I was exposed to the LPN program, but prior to that, I kind of just winged it and fell in love after that.
What motivated you to advance your education?
So it was the middle of the pandemic, and I said I can't do this anymore. I was tired. I had the opportunity to kind of be in the interim director manager role when my current manager had to be out for a little while. So I was exposed to leadership and kind of what that would look like. And I was like, I could see myself doing this. So when the opportunity presented itself, I applied and I got the job. But yeah.
Did you receive any financial support or tuition reimbursement?
So in the beginning, no, I had FAFSA, student loans. However, my senior year in college, so really my junior year in college, I got a academic scholarship. So I got $10,000, and then that paid for my senior year. And then my job gave me free housing. So literally senior year was free for me.
What is your strategy for paying back student loans?
I have actually been fortunate. I did. So I would say I have gracious parents that have helped me along the way. I'm one of few that have graduated college in my family. So as like a congratulations to me, they paid off majority of my student loans. So I paid for my master's degree myself out of pocket because my job offered some tuition reimbursement. So I leveraged, the system I worked for, and yeah. So I'm almost done paying off my student loans.
Any advice for nursing students in clinical rotation and orientation?
Um, I would say that you get out of it what you put into it. So, um, definitely showing up and putting your best foot forward and asking a lot of questions and getting into the room and seeing the patient, talking to the patient. It doesn't even have to be related to whatever you're whatever you're supposed to be doing at the time. But I think the more you talk to patients, they become less scary, and the more you talk to staff members, they become less scary. So just being in the environment.
What's one thing you think students should know about nursing that's not taught in nursing school?
Um, I think people need to know it's hard. I don't think people talk about how hard it is and how it can be physically taxing. It can be mentally taxing. Um, it's you don't have a job like the rest of your friends. No one else is working nights and weekends and holidays, and when they go to work, you're going to sleep if you're working nights. That's something that I struggled with a lot as like a newer nurse. Just finding that work-life balance, right? It looks different, I think, for nurses and other people. So that's one thing.
What, if any, changes would you make about nursing education and training?
So my my big thing, I think, is that there's not enough exposure. I think all nursing schools, they give you clinical rotations in med surg, psychology, psych. Some people get community health. There's just very specific things that everyone does, but they don't expose you to other aspects of nursing. So then when they get to me and they have all these options, they're like, oh, well, I wonder what oncology is like, or I wonder what, just different things. And I think more exposure to just different areas of nursing in the beginning will be helpful to those who are trying to figure out what they want to do with their life. Or maybe they want to try something and then try something else and then try something else. But it's hard to know what you want to try if you don't even know the opportunities that are out there.
When and how did you get your first mentor?
I would say I don't feel like I have any true mentorship. I have people that I look up to, but an actual mentor who I feel I can call that official title, I don't feel like I have one.
What advice do you have for what advice do you have for how mentees can add value to their mentor-mentee relationship?
Um, I guess it's kind of difficult. I don't have one, but I guess if I had one, just it's important to know who that person is as an individual. So looking beyond however we connect, looking at the person holistically, seeing who they are, and going from there.
What specialty did you think you were going to get into at the beginning of your journey?
Oh, I just knew I was going to be an ICU nurse. But it just didn't work out that way.
What attracted you the most to your current specialty?
Um, I previously talked about it. I was no longer in working on my feet. I was tired. And I actually really enjoyed precepting when I was at the bedside. So my next journey in life was either going to be education or another role where I feel like I can support and mentor nurses, because that's really where my passion and my heart is.
What deterred you from some of the other specialties?
Um, I was firm. I did not want to be a nurse practitioner. That's one thing I really did not want to do. I didn't want to be a provider. I think kind of similar to how I answered the question before, but my passion was just, I saw nurses just who struggled, and finding a way to support nurses, because I knew the bedside is tough and I wanted to figure out how to just pour into them and be their mentor.
How would someone know if they have what it takes to be in your specialty?
Um, I think leadership can be tough. So I think people that have tough skin, have good conflict resolution skills, have a mind for business. I didn't realize how much that played an effect on my particular role until after I was in it. But definitely having a business mindset, and then definitely being a people person.
Who should not enter your specialty?
I think people who I don't know. Let me see. Who shouldn't enter my specialty? Who shouldn't be in leadership? People who want to still take care of patients.
What does continuing education look like for you?
So taking different courses online, going to different professional conferences. At this point, I kind of just do what's required of me.
What does professional development look like for you?
For me, I actually, at this point in my life, really, I like going to conferences. I really feel like you get to meet a lot of different people, and then you can find what's new in healthcare, and kind of maybe if there's a niche that you find that you really enjoy. Like right now, my big niche is virtual nursing in the virtual space, and so pretty much all of the conferences that I go to right now have some type of virtual component to them, because that's what I want to know about.
What does networking look like for you?
Networking for me personally is being in those spaces, um, meeting people in your specialty, outside of your specialty. I think it broadens your horizons and it helps you grow as a person.
Where did you learn how to negotiate?
I didn't.
How, if at all, has your nursing practice affected your relationships?
Um, I don't know. I feel like I have changed as a person. I feel like nursing kind of you see people differently after you become a nurse. So I think I'm less empathetic to my friends because I give that all day. So the people around me get less of that of me because I just don't have it to give. But yeah,
How many hours do you work per week?
I am supposed to work 40 hours a week. I would say the blessing of my current job is I have flexible scheduling. So if I feel like maybe I worked 10 hours one day, I can work 6 the next. I can work from home now. So there's definitely more flexibility into ensuring I work those 40 hours. But depending on what's going on, I'd say probably no more than 50. But 40 is what I should be working.
Do you work nights, weekends, or holidays?
Absolutely not. That was definitely a when I moved on to my next education. I mean, not well, that next phase of my career. I didn't want to do that anymore.
On average, how many patients do you see in a day?
If I'm seeing a patient, there's probably a problem. So, not very many.
What does your typical day look like?
So my typical work day, I get to work between 7 and 7:30. I usually round on my units to see if anything happened overnight, see if they need any support from me. And then I usually have a slew of meetings throughout my day on various topics. In between there, still checking in with the staff, eat a little bit of lunch, checking in with my coworkers to see if they need any support as well, because as leaders we should make sure that our colleagues are okay. And then I'm out the door usually between 3:30 and 4.
How much time do you spend on charting?
I do not chart anymore.
What's the most common advice you give to your patients?
Well, I don't really give patient advice anymore per se, but typically if I'm seeing a patient, it's usually because there was a conflict between the nurse and the patient. So it's usually trying to do some conflict resolution.
What's your most memorable patient encounter?
My most memorable patient, I was a bedside nurse, and he had a form of brain cancer, so he couldn't really remember things and what was going on. But for some reason, he remembered that he thought that I had took some graham crackers from him. So he was just yelling out, she stole my graham crackers. She stole my graham crackers. And I don't know why I remember that guy. I think I was just a new nurse and I was afraid. But he just stands out in my mind.
What's your most challenging patient encounter?
My most challenging patient encounter, we certainly had, when I was bedside nurse, we had a patient that was on the floor for a year plus, and he was definitely mentally and physically challenging for all of us to take care of him. But he ended up leaving and coming back. When he left, we sent him to like a rehabilitation place, and when he came back, he was the same but different in a way that we were able to understand him, and it was I had never felt more fulfilled as a nurse to really see like where he had began and where he ended up being. We He left us his number. It was yeah. He was challenging in the sense that I still have the marks on my hand from when he was scratching me, but also rewarding in the space of this is what medicine is for.
What's the toughest part of your job?
The toughest part in my current job is probably discipline. Um, well, maybe not. Okay, I took that back. The most difficult part of my job is convincing upper management or upper leadership of the things that we need to and rallying for resources and on the unit.
What's the most rewarding part of your job?
The most rewarding part of my job is promoting growth within my staff. Currently I have a lot of my nursing assistants, clinical technicians that are in nursing school, and just being able to support them in a way where whether that's giving them a schedule that allows them to be comfortable and pass tests, and letting them see things they probably wouldn't have seen in nursing school, and kind of just pouring into them and watching them grow, even if it doesn't result in a benefit for me or my unit, but just supporting people in their journey.
What's your best clinical skill?
I think my best clinical skill is talking to and managing challenging patients. I don't know why, but some people you just can't, redirect. But I think I have a special way of getting people to calm down.
Who are you most grateful for on your care team?
I'm most grateful for people that challenge me and, help me become a better leader.
Do your friends or family ask you random medical advice?
All the time.
Do you give unsolicited medical advice to friends or family?
I try not to because I don't want them to blame me if things go wrong.
Do you ever get nervous or anxious? If so, how do you manage those feelings?
I do, and I actually talk to a therapist a lot of time about it because I don't feel like in my younger years I was anxious, and I feel like in my older years I've become more anxious for whatever reason. And she's helping me navigate through that.
What are your hobbies outside of practice?
I like to sleep. I like to eat. Travel, hang out with my friends, and then I'm an active member in my sorority, Sigma Gamma Rho Sorority Incorporated.
How do you spend your days off?
Usually sleeping, and I usually try to do one activity like out of the house.
Who do you go to for help?
At work, I usually go to my colleagues. Outside of work, my mama.
What is one thing you're afraid of?
Letting people down.
Coffee, tea, or soda?
Soda.
Scrubs or no scrubs?
Scrubs.
Are you an introvert or extrovert?
Both.
Do you think there are more introverts or extroverts in your specialty?
I think there are both. I see it's an even split if you ask me.
We're hanging out for the day. What's on the agenda?
We somewhere in there we getting some food.
How many hours of sleep do you get on average?
Probably 8.
When does your day typically start and end?
I wake up at 5 in the morning. I live pretty far from my job, so I have to start pretty early, and then it ends around like 10.
If you weren't in nursing, what would you do?
I probably would have been a teacher.
How much longer do you think you'll practice?
Well, I don't really practice now, but um, I'm okay. I'm I don't know. That's a loaded question. I don't know.
What should someone who's considering nursing do to prepare right now?
Someone to prepare. What should you do? What should you do? What should you do? I think people who, as someone who hires staff, I think people should really get exposed to healthcare. I think a great way just to get your foot in the door is by becoming a CNA or a PCT or a ClinTech. It gets you just exposed. You don't even. It's not even to just get you into the nursing field, but just getting you in the door of healthcare and seeing what's out there. If you're looking more toward the bedside route, but I definitely think that starting there will help open your eyes to the possibilities that are there.
How has your experience in nursing changed the way you see the world?
Um, I think I just see people for who they are. Um, you know, sometimes I can look at people. I look at people walking down the street, and I don't know. I try to see people differently, um, because you get to know one aspect of somebody, but then you realize people are so complex, and every bit of them affects their health and their life, and realizing that the part that you're meeting isn't the totality of that person. So that's probably what has opened up my mind the most, being a nurse.
What's your perspective about the current state of healthcare?
We are struggling. Um, yeah, I don't even know where to go with that one, but it's very tough right now. Healthcare is it's tough.
What's one thing you would change about healthcare?
I would. What would I change about healthcare? I don't know, but something needs to change. There's so many things.
Is healthcare a right or a privilege?
Healthcare is definitely a right.
What changes are taking place in your specialty as it relates to clinical practice and in research?
That's a good question. I think kind of a hot topic right now. We focus a lot on like bedside RN well-being and burnout, and I think we're now exploring what that looks like for leadership.
What do you want the public to know about nurses?
I want the public to know that what you see on TV is not real nursing. All those things you see those doctors do on TV, it's actually a nurse that does that in real life. And nurses are, we have degrees. We're very educated. We know what we're talking about. Um, just, we are the key. We are the link to healthcare. Without nurses, I don't know what healthcare would be. So that's what I want people to know.
If you had one more hour in the day, what would you do with it?
Sleep.
What's your opinion of healthcare professionals using social media?
I think there's an avenue for it. I don't think everybody should do it, but there's definitely a space for it.
What did you think you were going to do? What did you think you were going to be when you were a kid?
I'm a teacher.
What advice would you give your younger self?
Don't limit yourself. If you're not happy, try something else.
What would you do if you could do it for free?
Travel. I'm going all over the place. However, I don't like being on planes that long, so it depends on how long the plane ride is.
What can we expect from you in the next 12 months?
Um, I don't know. Probably still this. I love it.
What advice would you give to the aspiring nurse?
I would give, let's see. Um, oh, maybe probably just that there's just so much out there, and um, just research and find your passion. And it's okay if your passion changes. Um, but I think most importantly, just do whatever makes you happy.
Thank you.